Hi, good afternoon. Welcome to another episode of Me and Your Vet Talk Show. I remain your host, Dr. Clara. And with me, our guest speaker is Dr. Motunrayo. Welcome to another episode. I hope you have been enjoying all our talk shows so far. So let's get right into it. Today's topic is very, very sweet. It is PPR in sheep and goats. So first of all, let's get to this fast. What is PPR? Some people were like PPR. PPR like what? So let's find out what exactly is PPR and what type of what causes it. Let's go like that.
Yeah, good morning. Good afternoon once again. Yeah, PPR, it's a viral disease of ruminants, which is called the Pestis, the Petits Ruminants. And it is common in sheep and goats. Like, it's one of their major diseases, actually, which affects goats and sheep. And then it causes high mortality. And it's always acute, like sudden. You might not notice anything, sudden death, and then sudden acute symptoms. Let me put it like that way. Like, so just suddenly see certain symptoms like death, diarrhea, respiratory disease. So
Hmm. The pestis ruminants.
ruminante.
Sorry, it is sweet like French. So it says a virus and it's very contagious and it causes high mortality. No, we said mortality means death. So meaning there will be high loss of your sheep and your goats. Okay, thank you, doc. So what are the common? You spoke about you seeing symptoms and before death. What are those common symptoms or signs that a farmer will notice to say, oh, this could be PPR?
Let me start by when you don't get your goats from a reputable farm, like farm that you know that they follow strict vaccination, strict biosecurity, you are most likely you have the tendency to have this disease outbreak in your farm. So when you notice that you just recently got your goats and sheep from a market and then you bring it to your farm and then all of a sudden they stop eating, they start becoming swollen, you start noticing diarrhea, like watery discharges, and then you start noticing kata, like running nose and nasal discharges, and they look like that's where you something should just pinpoint to you that ẹ̀wọ̀n míì ti come down pẹ̀lú PPR.
PPR.
So the sign and symptom is categorized into three phases. We have the respiratory symptom, we have the what is it called, enteric symptom, and then we have the one that has both. So for the respiratory symptom, what you just see is the goats and sheep will have difficulty in breathing, so they might be coughing, and then when they cough, you hear the sound and then the respiratory discharges, you see thick mucoid, like big thick mucoid. So why they will have the respiratory symptoms is because their nose is blocked with that thick kata. Some might not be able to come out full. We are not like human being that when the thing did not come out, we try to keep on blowing. But then, if they don't bring it out well, it gets stuck inside their nostrils and then can block their airways. So that's one of the most things that I used to call the symptom. And then for the what's it called, enteric symptom, you start seeing blisters from the mouth, from the tongue. You start noticing that they start having watery diarrhea, like watery pupils, that every time your pen is filled with pasty, watery feces. So with that, they start losing fluid and then they become dehydrated. So that's one of the most things that used to kill them, because it's always acute. You just see them, even with the treatment itself, it takes God's grace to be able to save the farm, because if one comes down with it, all the stock will be affected. Most of your pen, your goats will die. So when you start noticing, it's better you call your doctor immediately and then you isolate that particular one. So for the mixed one, they are the one that will start showing both sides, both the respiratory and then the enteric. You start seeing everything once all of a sudden. So when you start noticing one or two of these from your pen, you should know that this is an emergency. Call your veterinarian immediately so that they will do, even with the with the impact of the veterinarian self, it takes God's serious to save the goat. But at least you know that you're saving the other pet, that so that they don't come down with this
Yeah.
particular virus because it spreads so fast and it's acute, and then the mortality rate is very high, very very high.
Thank you, Doc. So I've learned about the symptoms, various parts of them. So now you talk about how you say it's very contagious, it spreads. How exactly does it spread? How? Like, is it that as one just comes down, the wind just blow, everything will just able to just get it all? How does PPR spread?
Yeah, let me start by saying how it's come what's it called, how it starts first. I get your farm first, because sometimes it might be you when you notice it when you just acquire a new pen. And if you are the type that have a big farm, you don't you notice it when you acquire a new set of flock, like a new set of sheep and goats, and then you suddenly introduce it to your farm. This is a bad act. Because when they are coming, they are always, most of this what is it called, viral disease, like let me say this PPL, it's most an opportunistic infection than a real virus itself. I don't know how to put it for you so that you understand. So when a stressor factor affects an animal, their normal microflora becomes what is it called? They are called opportunistic
Immunocompromised.
yes, their immune become compromised. So the normal microflora become an havoc, like begins to attack their own system. Let me put it like that so that you understand. So when you don't take a strict measure, when you, because of those stressor factor, they are immunocompromised, and then they start coming down with it. So this is why it is advisable when you just get a new set of goats, do not make them with the one that you have in your farm. Call a doctor to treat them so that you observe them and watch them so that you don't you lose all of them altogether. This was the question again, sir.
How does it spread rapidly?
Yes, how does this spread? So when one has it, termites, direct contacts,
Indirect contact.
indirect contacts, you as a farmer can spread it to the ones that does not have it. Your slippers can spread it to the one that does not have it. Goats mixing with each other can spread it among themselves. So it's termites, even nylon. If nylon in your farm, stay on the what's it called, the diarrhea or the kata of the nasal discharges from the one that has it. If that nylon goes to the pen of the one that does not have it, they will come down with the virus. So you have to take biosecurity very very important, and you have to know how to do what is it called, quarantine. Thank you, quarantine. You have to quarantine new set of animal that you're bringing to your farm so that you can watch them so that you don't lose every of your flock at once.
Thank you, Doc. I was about to ask you, this question was prevention methods. Since we're talking
Okay.
about what causes it, how it can be, spread. So now, what are the things that farmers have heard you now? Have heard you that, oh, this thing is a virus, very contagious. When you bring in dogs or some goats and sheep from a market and you just put them in, they could have it, they could not have it, and you just get it from, when termites and all. So now, what can they do? They don't want to have PPR on their farm. What are the preventive measures they can do? I want to go and buy a goat. I want to go and buy sheep. I want to start a sheep. I want to start a goat farm. What do you do to prevent this?
So first and foremost, biosecurity. Biosecurity is very very important when it comes to animal. They don't know, we are the one that know. So you have to inculcate biosecurity in your pen, in your farm. Secondly, quarantine. When you get new set of goats, you have to quarantine them. You do not mix. You do not mix. So, and then thirdly, which is the most important, vaccination. When you don't get what is it called, your goats and sheep from a highly reputable farm that you know that they follow the standard, you have to call your veterinarian to first observe them and then check if they are fit for vaccination. So there's PPR vaccine available. You have to tell them so that they can help you get the vaccine and then inject your goats so that at least this will prevent them from coming down. And even if they come down, because most of the time now, vaccine might not be able to provide immunity due to some certain things, certain factors. At least you know that they have that immune system to fight in case something like that comes up in your farm. So the most important thing is that you have to vaccinate your flock, vaccinate them, call a doctor to your farm to observe, to do a general observation, and then to advise you on what and what to do, and then they can help you vaccinate your flock.
Okay. Thank you very much, Doc. So let me just give a summary of PPR. Said it's a virus, highly contagious and spreads very, very fast. And it occurs mostly in sheep and goats. And we'll talk about the symptoms you will see. They're divided into three. You have the respiratory symptoms, enteric symptoms, and where you have the combination of both of them. Respiratory, you're going to be seeing them to be having difficulty in breathing, may have sneezing, may have coughing. And when they now try to even sneeze, you will see that they have discharge that is very mucus and very thick like catarrh. Then the enteric form, you have see them having sores in their mouth, all over their mouth, in their tongue, on their teeth. And because of that, they won't be able to eat. So before you know, they will stop eating. Then last, started seeing having them having diarrhea, very, very bad diarrhea. And that is one of the ways where it's, how it spreads. So if another goat that's on his own, and that sheep that's on his own, that does not have it though, but it comes in contact with the diarrhea of an infected goat or sheep, or comes in contact with their mucus, you get infected. So how to prevent this? The first thing to talk about was vaccination. Vaccination. We always talk about vaccination. It's not just because it's sweet in our mouth, oh. It's because it's very, very important. Vaccination is providing your animals antibodies to fight against this, antigens, this virus, to give them at least that strength to fight and help them not succumb to the disease. But we spoke about stressors too. So if we are bringing a goat from a long distance and you just bring them, you not even put them in one place, quarantine them and observe and say, will they come down with anything? You do not call your veterinarian and say, I'm trying to stock up goats and sheep, or what should I do? You just bring goats and sheep and put them in one place. Then you have goat and sheep, if you now put them all together, you don't know what the other one is bringing. That's why she advised that always when you're bringing new ones, quarantine them in one place, because you don't know what they have. There are some diseases that don't show themselves. You don't just you see signs and symptoms. You just know that I added sheep and goats to my sheep and goats, and now gbogbo wọn ń kọ́. It's because that one has brought something into the farm. That's very important to always call your veterinarian to let them know that mo fẹ́ gbé àwọn míì wá sí ibi, so they will let you know that we are quarantine them at least 2 weeks, so that you can observe and watch and see, is there any signs. After 2 weeks nothing is there, it means they are good to go. But some things that you're supposed to are giving to them so that it will boost their immunity, because they have gone through stress, you don't know what they are eating there, you don't know what they are exposed to in that environment. So it's very important that you speak to your veterinarian before you bring new stock, you vaccinate them. There are so many things you should do. Then biosecurity is very, 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 very important. Always be sure that you are clean. Your seriously that's going to the farm is clean. Your clean slippers, your clean dogari, your clean water. Then sometimes talk about the water that you put that has disinfectant before you go in foot deep. So it's very important to have a clean place, clean biosecurity, you quarantine, you give vaccination, and you speak to your veterinarians. I hope you have learned a lot from this episode. If you have any question, please put it in the comment section below. We'll get back to you on that. And please don't forget to share. Let's tell people about you and your vet. I know you're learning from this, so don't just keep it to yourself. Tell your families, your friends, people that have farms. It must not be about this topic. If you have any questions, just ask us and we'll help you to the best of our ability. Thank you for joining us this week. See you next week. Bye bye.